More than 1 in 4 Americans over 65 fall every year, and nearly half of those falls result in serious injury or permanent loss of mobility. What's truly concerning is that many of these falls are preventable, but the warning signs are often ignored. A dull ache in the legs, tingling feet, a strange sensation that feels off. Most people dismiss these as part of aging, but in reality, they could be early signs of nerve pain, not just getting older. So how can you tell the difference between muscle pain and nerve pain after 60? And if you've been unsure, what can you do now to avoid serious, even life-changing consequences? In this video, I'll show you how to clearly identify the difference between muscle and nerve pain. And I'll reveal the critical mistake that over 80% of older adults make every day, the mistake that causes many to treat their leg pain the wrong way. If you believe this is an important topic that deserves more attention, leave a comment with the number 1 to let me know to keep creating more helpful content like this. Part 1. The pain you think is normal could lead to your last fall. After 60, leg discomfort can come from many sources. One of the most common is muscle pain, but it's often mistaken for nerve pain because the symptoms can seem similar. Knowing how to tell the difference can determine whether you simply need rest or urgent medical attention. Muscle pain usually feels like a dull, localized ache that shows up after physical exertion. It may happen after a long walk, climbing stairs, or standing for extended periods. Once you rest, the pain typically fades. You might notice tight calves or sore thighs. And crucially, muscle pain stays in one place. It doesn't shoot down your legs or follow nerve pathways. But if pain appears even while you're resting, especially if there's burning, numbness, or a tingling sensation like pins and needles, there's a strong chance it's nerve-related. This is where many people go wrong. They mistake nerve pain for sore muscles and start using the wrong treatments. One woman, 67 years old and living in California, experienced aching and tingling in her calves after grocery shopping. She thought it was just fatigue, so she applied warm compresses and rested. But the pain didn't stay put, it spread to her feet. She was later diagnosed with early-stage sciatic nerve pain, something that requires a very different approach. If you're unsure whether you're dealing with basic muscle soreness or early nerve damage, I highly recommend exploring the playlist, Leg Pain After 60 Natural Relief and AMP Tips. It's linked in the description and filled with practical daily habits that help improve circulation, reduce pain, and strengthen your legs naturally. Understanding the difference can protect your independence. Treating nerve pain like muscle pain doesn't just delay healing, it can lead to worsening symptoms, serious falls, or long-term damage. Ask yourself, is this just muscle fatigue, or is it a warning sign of something deeper? If you're confident it's muscle-related and there's no burning, numbness, or nerve-like sensations, you can often treat it naturally at home. Start with proper rest. Not complete immobility, but enough to reduce muscle strain. Apply warm compresses for 15 to 20 minutes to promote circulation and relax tight muscles. Studies from the Mayo Clinic show this can ease tension and improve comfort. Add simple stretches like heel raises, ankle rolls, or straight leg lifts while seated. These help reduce stiffness and improve blood flow, especially if you're mostly sedentary. Support your muscles with the right nutrition. Focus on protein, calcium, vitamin D, and omega-3s. Anti-inflammatory foods may also ease muscle tension. Supplements can help too, but always consult your doctor first. But what if the pain isn't muscular at all? What if it's coming from your nerves, something deeper, something you can't see? That's what we'll cover in the next section, and it might explain why so many people slowly lose strength, balance, and mobility without ever realizing the real cause. Part 2. You may not notice it, but your nerves are quietly crying out. Unlike muscle pain, nerve pain in the legs often develops slowly and silently, and if left unchecked, it can lead to serious, even permanent, consequences. Many people over 60 assume all leg pain is due to muscle fatigue, overuse, or simply part of getting older. but that assumption puts millions at risk. When early signs of nerve damage go unnoticed, they can eventually lead to numbness, leg weakness, balance problems, and even a loss of mobility, without the person ever understanding what happened. One of the biggest mistakes is self-diagnosing leg pain as muscle strain, then trying to walk it off, apply patches, or use massage therapy. But muscle pain and nerve pain are fundamentally different, and so are their treatments. Trying to move through nerve pain without the right approach can actually aggravate the nerves, cause more compression, and trigger widespread inflammation. One classic symptom of nerve pain is leg numbness, a cotton-like or disconnected feeling in your feet, or an inability to sense where your legs are while walking. Others experience burning or stinging pain, especially at night or after long periods of sitting. And if you've ever felt an electric-like shock traveling from your lower back down your leg, that could be sciatic nerve pain, one of the most common nerve issues in older adults. Unfortunately, many people misjudge nerve pain as simple soreness for months. They take daily painkillers, thinking they're helping, but in reality, they're only numbing the symptoms while the root cause worsens. Over time, this leads to reduced circulation, weakened legs, increased fall risk, and in some cases, irreversible nerve damage. In fact, research from the National Institute on Aging found that nearly 30% of seniors with nerve-related leg pain are misdiagnosed in the early stages, largely because the symptoms are misunderstood or ignored. So how can you tell if it's nerve pain? Listen to your body. Does the pain travel along a pathway from your back to your thigh or foot? Is it accompanied by tingling, numbness, or a burning sensation? Does it persist even when you're at rest? These are all hallmarks of nerve pain, not muscular soreness. Take the case of a 72-year-old man in Florida. He walked every morning for exercise. One day, he noticed a tingling feeling in his thigh, but assumed it was just from walking too much. He kept pushing through it, thinking it would fade. But within weeks, the sensation worsened. He could no longer feel the floor tiles beneath his feet. Eventually, he fell in his kitchen and was diagnosed with sciatic nerve damage from spinal compression, something that could have been managed early if caught in time. Another common misstep is following generic leg pain exercise videos online without confirming the source of the pain. Some exercises are beneficial for muscles, but they can actually worsen nerve conditions if done improperly. And since nerve pain can come from multiple causes, B12 deficiency, diabetes, spinal stenosis, or even poor posture, treatment needs to be specific to your condition. Here's what matters most. If you can still feel the pain, you still have time to act. But if your legs feel weaker, unstable, or like they're not even yours, that's a critical warning sign. And if you're unsure whether it's muscle pain or nerve pain, err on the side of caution. Nerve pain is more dangerous, more persistent, and requires professional care.